Hi guys, now we'll be starting with important topic, that is metallic irritants. Metallic irritants, they are heavy metals and they cause inflammation of the tissues. That is the reason why they are called as metallic irritants. This topic is highly important. You get lot of questions from this particular area. Okay, be it INICET, be it NEET-PG, this is one very high-yield area where you get lot of questions frequently asked. Not only that, nowadays you get lot of cases of heavy metal exposure very commonly seen, right? So you need to have this particular knowledge not only for your MCQ purpose but is also for clinical practice as well. Okay, fine. Right, let us start individual poison, but before starting individual metal, I would like you to know certain basic points. The first important point is, do remember friends, most of the metal, they are cumulative poison. What does it mean? They get accumulated inside the body itself. So more prone for chronic poisoning. They are more prone for chronic poisoning. And when you look at the poisoning case as such, if they ask you which is the most common acute, most common heavy metal poison, you need to tell it is arsenic. Right? If they ask you which is the most common chronic heavy metal poison, the most common chronic heavy metal poison, that is due to lead. Right? Lead poisoning is the most common chronic heavy metal poison. Okay? Right. And these poisons, what they do is, the metals, what they do is, they bind to sulfidal group of enzymes. They inhibit the sulfidal group of enzyme, and that is how it causes cell injury. It causes cell injury by inhibiting the sulfidal group of enzymes. Okay, and now you see that I told you that it's a cumulative poison, gets accumulated inside the body itself. There are few selected sites where it can get deposited, and that we can use it for diagnosis. Okay, what are the selected sites? We discussed it earlier. Metals, they got the property of getting deposited in the bone, they got a property of getting deposited in the hair and also the nail. So you can use these samples for the detection of chronic heavy metal exposure. Okay, right. And if you want to detect, if you want a urine, if you want to use any other sample for the diagnosis, you can either use blood or you can use urine for the detection. Right. If you are using blood, right, the lead. For lead poisoning, blood is the best sample to detect. For arsenic, urine sample is the ideal sample to detect. Okay. For arsenic, urine sample will be the ideal sample to test. Right. Since most of the poisoning are due to chronic exposure, the most important treatment aspect, what you have to do is removal of exposure. You need to remove the exposure. That will be the primary modality of the treatment. And then whatever metal that has already got accumulated inside the body, you need to take it out. For that, what we can use is, we can use a group of agents, antidotes called chelating agents. What are chelating agents? They are the agents like your BAL, like your EDTA, DMSA. These are the agents. What they do is, they chelate the metals. They chelate the metals are present inside the tissues of the body. These chelating agents, they bind to the metal and they get excreted out of the body. Okay, that is what it basically does is, it is converting the insoluble form of metal into soluble complex. Right? Whatever insoluble metal that you have in the body, that is converted into soluble complex, that will be easily excreted from the body. Right? And that is how it works. That's how it works. So basically, I've told you the general points. It's cumulative, getting deposited in the bone, hair and nail, and most of the poisoning are chronic, wherein you just have to remove the exposure and give chelating agents that will treat the patient. Okay, so these are the general points that we have to know. We'll be starting with the first metal, that is arsenic. Arsenic, though we are discussing under metallic irritants, this is actually a metalloid. Means it has got the property of metal and non-metal as well. Let us look at the forms of arsenic. Arsenic, it has got elemental form, the pure form, elemental form. This elemental form is not absorbed in the GIT, so it is basically not toxic. Right? Pure arsenic is not toxic. Then comes your organic arsenic, organic form. This organic form, we have got a lot of examples. We have arsinocholine, arsenobutene, right? All these are again non-toxic, which is commonly present in multiple places, right? It can also be present in shellfish and all. Then comes your inorganic form. This inorganic form, we have two important versions. One is inorganic salt, another one is gas. Let us look at both the forms. Inorganic salt. Inorganic salt, the first and most important one is arsenic trioxide. Arsenic trioxide is the most important salt which was widely used in olden days. It was also called as inheritance powder. It was widely used for what? It was used for homicidal purposes. That's why it is called as inheritance powder. Why this is specifically used in homicidal purposes? Because it is colorless, tasteless, odorless. You can easily mix it with any food, give it to the victim. The victim will not be able to identify that it has got arsenic, and the person will die of poisoning. Okay, so that is why it is called inheritance powder. You want to have a look at the inheritance powder. This is the inheritance powder, that is arsenic trioxide. Okay, the most toxic salt of arsenic. This is most toxic salt of arsenic. Most toxic salt of arsenic. Right. The next important form of inorganic thing is you have Scheele's green. Scheele's green. What is that Scheele's green? Scheele's green is basically copper arsenate. Copper arsenate. We also have one more green, that is Paris green. What is that Paris green? Paris green is basically copper acetoarsenate. Copper arsenate, copper acetoarsenate. We have got two important green color pigments which are very beautiful to see. In olden days, it was very commonly used as a pigment. It is used as a dye. You can see that this is Scheele's green, right? This is Paris green, where it is commonly used for painting and all. It is used for painting. It is used for wall paints. It's very commonly used, right? You know the famous Napoleon Bonaparte. There are multiple theories of around his death, how he died. Okay, one of the theories says that is he was having the Scheele's green and Paris green in the wall paint, which got diffused into the air. The person who was staying, the Napoleon, used to inhale the arsine gas and gradually he died of chronic arsenic poison. This is one version of that is theory that is postulating his death. Okay, fine. Now let's move further. Let's start discussing the gaseous form. What is a gaseous form? Gaseous form is arsine, right? It has got garlic odor. And do remember, if they ask you which is the most toxic form of arsenic, the most toxic form of arsenic is arsine. Right? If they ask you what is the most toxic salt of arsenic, then your answer should be arsenic trioxide. Okay, arsenic trioxide is most toxic salt, arsine is most toxic form. Let us look at the different poisoning that you get here. We'll discuss what are the different poisoning that we'll get here. You can see there are three important types of poisoning. One is fulminant poisoning, when the person takes massive amount of arsenic, let us say 3 grams of arsenic, the patient dies. Patient dies due to cardiovascular collapse immediately. That is fulminant. Second one is acute arsenic poisoning, where the person takes large dose. In fulminant poisoning, I told the patient was taking massive dose, whereas in acute poisoning, the patient takes large dose of arsenic. Okay, and then the patient takes small dose of arsenic over a long time. The patient may suffer from chronic poisoning. So it all depends on the dose, whether it is massive, large or small doses. Fulminant, acute and chronic. For examination purposes, you need to learn about both acute and chronic. We'll be discussing on that. So let us start discussing the acute arsenic poisoning. See this acute arsenic poisoning. Acute arsenic poisoning, let us talk about that. You see, the fatal dose of arsenic is 100 to 200 milligram. 100 to 200 milligram, that is a fatal dose of arsenic. Okay, so when a patient takes this arsenic, acute arsenic, what happens is large dose of arsenic, what happens is there are two forms of poisoning. Number one, he can get two kinds of symptoms. Number one, he can get gastroenteritic form. He can get gastroenteritic form, or he can also get narcotic form. Narcotic form is where the patient will have neurological disturbances, the patient may die. Whereas this gastroenteritic form, the patient will have profuse diarrhea. The patient will have gastroenteritis. The patient will be presenting with what is called as loose stools. The patient will be presenting with what is called as hemorrhagic gastritis. Fine. Hemorrhagic gastritis. Since the patient is having profuse diarrhea, they also say that this acute arsenic poisoning, it resembles cholera. It mimics cholera. Because cholera patient will also having profuse diarrhea, acute arsenic poisoning patient will also have profuse diarrhea. They say this is the disease which resembles cholera. Okay, resembles cholera. Now, how to differentiate whether the person is suffering from acute arsenic poisoning or cholera? We need to look at the sequence of symptoms. Let us look at the sequence of symptoms. Right? Let us say the patient is suffering from arsenic poisoning. Right? The other patient is suffering from cholera. Fine. If it is arsenic poisoning, the patient will initially be presenting with throat pain. The patient will initially presenting with throat pain. Then the patient will have vomiting, and finally the patient will be presenting with loose stools, purging. Right? So it goes in the sequence. And when you look at the cholera patient, initially the patient will be presenting with purging, rice, watery stools. Then the patient will have vomiting. Due to repeated vomiting, the patient will also be presenting with throat pain. Okay, it is exactly opposite. Fine. And in arsenic poisoning patient, you can also look at the presence of tenesmus. What is this tenesmus? Anal irritation is a notable feature of acute arsenic poisoning, not with cholera. Okay. Suppose if the patient dies. If the patient dies due to acute arsenic poisoning, do remember while we do autopsy, in this case, what you can notice is you can see red velvety stomach mucosa. We can see red velvety stomach mucosa. You know why? Because I told you earlier, the patient is having hemorrhagic gastritis. That is the reason why when the patient dies of acute arsenic poisoning, during autopsy, you can see red velvety stomach mucosa. Okay, fine. So let's start with chronic arsenic poisoning. Chronic arsenic poisoning. This chronic arsenic poisoning, it is so common due to two important exposures. Number one, it can be due to accidental exposure, where the person may be exposed during occupation. If the patient is working, if any person is working in mines, if the person is working in smelting industries, the patient can get accidental exposure of arsenic. Not only that, do also remember, it is also commonly used for homicidal purposes. You know very well, arsenic trioxide is one commonly preferred poison for homicidal purposes. So the patient may develop chronic arsenic poisoning. Okay, right? Chronic arsenic poisoning is also called as arsenicosis. Do remember, friends, this is called arsenicosis, chronic arsenic poisoning. If the patient develops chronic arsenic poisoning due to drinking contaminated water, if the patient develops chronic arsenic poisoning due to contaminated water, contaminated groundwater, which is very commonly seen in Bangladesh and northeast region and all, where the groundwater is heavily polluted with arsenic. If the patient drinks such kind of contaminated drinking water, the patient may develop what is called as hydroarsenism. Right? We call this as hydroarsenism. Hydro means water, so hydroarsenism, very simple to remember. When you talk about the signs and symptoms, the clinical features, do remember this chronic arsenic poisoning, it occurs in 4 important stages. Number 1, it is GIT stage. Number 2, cutaneous stage, skin manifestations will be very common. Number 3, the patient will have neurological features. Number 4, it is neuromuscular features. Right? GIT, cutaneous, neurological, neuromuscular, it occurs in chronology. But for discussion purpose, for you to understand it better, what we can do is we can discuss system wise. Okay, let us discuss system wise. See, arsenic is something which doesn't leave any system functional. Like it affects each and every system of your body. We'll discuss one by one. Let us start with skin. It affects the skin. When it affects the skin, it produces what is called as dark brown pigmentation. The first one, it produces dark brown pigmentation. This dark brown pigmentation, this is also called as raindrop pigmentation. Do remember, friends, this is called raindrop pigmentation. This raindrop pigmentation is commonly seen in the flexures. It is seen in the flexures. It is seen in the temple. Right? Because of this, they also say that such kind of pigmentation, it resembles Addison's disease. It resembles Addison's disease. And the rash, the dark brown pigmentation may resembles fading measles rash. Okay? Arsenic poisoning, it resembles Addison's disease because of this raindrop pigmentation. Now, look at this palms and soles, wherein you will find what is called as hyperkeratosis. You will get excessive pigmentation, hyperkeratosis. Right? Where do you see hyperkeratosis? Hyperkeratosis is commonly seen in the palms and soles. Palmoplantar hyperkeratosis will be noted. particularly in the palms and sole. Bilateral hyperkeratosis noted. Bilateral hyperkeratosis noted. But do remember, these hyperkeratosis are wart-like growth. They are wart-like growth. They are carcinogenic. It can cause basal cell carcinoma. It can cause basal cell carcinoma. Chronic arsenic poisoning can also cause squamous cell carcinoma. It can also cause Bowen's disease. Right? So all these malignancies are very commonly seen with your chronic arsenic poisoning. Fine. Now look at the nail. When you look at the nail, let us say this is a nail. This is a nail wherein you can see the nail bed. When you can see the nail bed, you can see transverse white line in the nail. You can see transverse white line in the nail. We call this particular line as Ulrich-Mees line. We call this as Ulrich-Mees line, which is also called as Mees line, which is also called as leukonychia striata. Okay, leukonychia striata, forget about it, just remember Ulrich-Mees line. It is seen with arsenic poisoning, but do remember, it is not seen only with arsenic poisoning, it is also seen with thallium poisoning as well. It is also seen with thallium poisoning as well. That is one of the very important MCQ point that you have to remember, which was asked in your last year NEET PG. Okay, thallium poisoning as well. Okay, right. Look at the hair. The patient will have alopecia. The patient will have alopecia. And when you look at the blood vessels, the patient will be presenting with chronic peripheral ischemia. It is affecting the blood vessels. It can cause chronic peripheral ischemia. The peripheries will be affected. You know very well, when there is chronic peripheral ischemia, when there is blood supply not given to the peripheries, obviously the resultant condition is gangrene. So the patient will be presenting with what is called as peripheral gangrene. He will be presenting with what is called as peripheral gangrene. Okay, peripheral gangrene. Now, moving further, you can see that this is affecting the nerves as well. The chronic arsenic poisoning, it produces what is called as peripheral sensory motor polyneuropathy. Peripheral sensory motor polyneuropathy. Right? It is affecting the sensory nerves. It is also affecting the motor nerves. But initially, the sensory involvement will be more than the motor involvement. When the disease progresses, the motor nerve will also be involved. Particularly, it can cause muscle weakness and palsy. When the sensory nerve involvement is there, the patient will be presenting with paresthesia, tingling, numbness. These kind of paresthesia will be noted. Okay, sensory motor polyneuropathy. And that is the reason why we can also say that chronic arsenic poisoning, it resembles GBS, Guillain-Barré syndrome. Okay, not only arsenic, even thallium also it resembles GBS. Here, because it produces peripheral sensory motor polyneuropathy, we can say that it resembles GBS. It resembles GBS. Okay, right. Now, moving further, it affects the bone marrow. When it affects the bone marrow, it can cause anemia. So these are all the different manifestations that you can see with arsenic poisoning. I've given you everything in a slide. Now, let us see two important special conditions. What are the two important special conditions? Number one, it is called Toroku arsenic disease. Toroku arsenic disease. This was first noted in that particular region. When people, they consumed water and they inhaled air from a particular area. That area was contaminated. That area was contaminated with arsenic from a refinery. Okay, so this is basically due to inhalation of contaminated air or drinking water which is contaminated, okay, from a refinery. Contaminated due to refinery. Contamination due to refinery. Where these people, they developed malignancies, skin malignancies, lung malignancies, skin cancers, lung cancers, Bowen's disease. So these were all very common in this particular region. That's why it's called Toroku arsenic disease, which is due to contaminated arsenic in the water and from the air. There is one more special disease that you have to know. We call it as Blackfoot disease. Blackfoot disease. The foot will be completely gangrenous, dry gangrenous. Right, this disease is an endemic disease. This disease is basically an endemic disease in Taiwan. Right, this is an endemic disease in Taiwan where people they consumed arsenic in water, right, from an artisan well. It is basically due to drinking contaminated water from an artisan well, they started developing peripheral vasospasm. They started developing peripheral vasospasm. You know very well, when there is vasospasm, there is peripheral ischemia. When there is peripheral ischemia, the patient will develop gangrene, peripheral gangrene. That's why we call this as black foot disease. We call this as black foot disease. Okay, black foot disease. So two important conditions. Do remember, Tourette arsenic disease. Second one is black foot disease. Suppose if you suspect a patient is suffering from chronic arsenic poisoning, you need to diagnose. How would you diagnose? You need to take samples. What are the samples you will prefer? What samples that you can prefer? When you talk about the samples, you can see that what are the samples that you can prefer. Number one, you can use blood. You can also use urine. You can use hair. You can also use bone. You can use nail. Fine. If suppose blood sample is also given, urine sample is also given, if they ask you which is more reliable, the urine sample is more reliable. You need to see 24 hours excretion of arsenic in the urine. That is more reliable for arsenic. I told you earlier, urine is better for arsenic detection and blood is better for lead detection. If the patient is dead, you can also take a bone sample, right? Or if the hair sample, nail sample is there, you can use all these samples for the detection of chronic heavy metal poisoning, chronic arsenic poisoning. Okay. What are the different tests that you can do? What are the different tests that we can do for this? Earlier, we had two important tests. Number one, it is called as Marsh test. Another one, it is called as Reinsch test. We have Marsh test, we also have Reinsch test. But these two tests are obsolete. We don't do nowadays. It was olden days it were being done. Nowadays we have latest test. Number one, it is called as neutron activation analysis. Neutron activation analysis. We call this as NAA. NAA. We also have one more important test that is called atomic absorption spectrometry. Atomic absorption spectrometry. We have two important tests that are done for the detection of arsenic, AAS, right? So we have NAA, we also have AAS, two important tests. Fine. So we know how it is being detected. Right. Now, what are the places which commonly used? I told you it is commonly used for accidental poisoning. It is very commonly, accidental exposure is very common. I also told you homicidal exposure is also common. Homicidal exposure is also common. Okay, very common. But this homicidal exposure, see, when you prefer arsenic to kill a person, right? I don't say that, I would say that it is not a better choice. It's not a great idea that you use arsenic for killing a person. You tell me why. There are some disadvantages of using arsenic for killing a person. For homicidal, using it as homicidal purpose. What are the disadvantages? Number one, you can see when you use arsenic, generally what happens, the arsenic, it retards putrefaction. It retards decomposition. So you will get caught, right? Arsenic can be detected from decomposed bodies. If the body is advanced decomposition, you can find the presence of arsenic, right? Even if the body is advanced decomposition state, you can see the presence of arsenic, you can detect the presence of arsenic. Even if the body is completely skeletonized, even from the skeletal remains, you would be able to recover the presence of arsenic. They say that even from burnt ash, burnt remains, you would be able to recover the presence of arsenic, so you would get easily caught. Fine, right? So these are the disadvantages of using arsenic as homicidal purposes. Fine, disadvantage. Right. There is one more important terminology that you have to know, that is called arsenophagist. Certain people, they have the habit of using arsenic in a larger quantity. They can tolerate more amount of arsenic because they use arsenic as a love filter, aphrodisiac purposes. Love filter. Okay, aphrodisiac purposes. So they use arsenic in larger quantity. They can tolerate large quantities of arsenic. They can tolerate larger quantities of arsenic. They are called as arsenophagist. Arsenic. Right? So very important. They are called as arsenophagist. When the patient has come with arsenic, chronic arsenic poisoning, how do you treat? What is the treatment choice you have got? Number one, you can have BAL. We also call it as dimercaprol, British anti-lewisite. You can use that, right? Or if you want an oral form, you can also use DMSA. DMSA is also commonly called as Succimer, which you can use this for the treatment option. And as I told you earlier, for any chronic arsenic poisoning, any heavy metal poisoning, the first and most important thing that you have to do is removal of exposure. Remove the exposure, then you can go for this chelating agent. Chelating agent, I told you two options. Number one, it is your BAL, British anti-lewisite. Number two, it is your DMSA. So I've told you all the points. For you to remember better, what I can do is I can just give you a mnemonic to remember. What is the mnemonic to remember? Mnemonic should be easier to remember, right? First you should remember the mnemonic, then you can remember the points which it tells you. Okay. So I'll tell you the easy mnemonic. You can remember what is arsenic. You can remember arsenic. Okay, what is this arsenic? You know it's arsenic, right? So let us reduce from arsenic itself. Number one, A for anemia. It causes anemia. It causes alopecia. And it also causes Aldrich-Mees line. Right? Aldrich-Mees line. A for all these things. R for raindrop pigmentation. It causes raindrop pigmentation. Right? Yes. Septal perforation. You can see painless septal perforation, or you can remember painless septal perforation. Right? E for excessive keratosis. Excessive keratosis, excessive pigmentation. I told you hyperkeratosis. Excessive pigmentation. You see with arsenic. And N for neuropathy. I told you sensory motor polyneuropathy that can be detected in chronic arsenic poisoning. Okay. I for ischemia. It causes peripheral ischemia. You know it produces black foot disease. Peripheral ischemia. Because of vasospasm. Okay. The letter C, it resembles cholera. Cholera-like illness. And you also know that it is carcinogenic. It can cause multiple cancers, carcinogenic. So just do remember arsenic alone. You would be able to remember most of the points related to chronic arsenic poisoning. Okay. So this is one important mnemonic that you can use for remembrance purposes. Okay. So this is Aldrich-Mees line. You can see the transverse white line in the nails. You should know that I told you this is not only seen with arsenic but is also seen with thallium. This is your excessive pigmentation in the palms and soles that is seen with chronic arsenic poisoning. So we are starting with mercury. Mercury is also called as quicksilver, and you know it is a liquid metal. So which is nothing but mercury. We are talking about mercury. You know the chemical name of mercury is hydrargyrum. Chronic mercurial poisoning is called as hydrargyrum. There are many places where the mercury is used. It's used in photography, it is used in fingerprint powder, it is used in, you have thermometer, barometer, it is used in thimerosal vaccines, it is also used in dental amalgam, many places it is being used. It is also seen in seafoods, people who use seafoods, even in seafoods you have this mercury. Okay. Not only that, there are two important occupations where it is common. People who are involved in hat making industries, because when they take the wool, they process it. They use mercury thiocyanate solution. When they keep on using this solution for a long time, they develop mercury poisoning. Number two, glass blowing occupation. People who are involved in glass blowing occupation, they also have the risk of developing mercury toxicity. Two important occupations. Number one, hatters. Number two, glass blowers. Okay, so we'll discuss about that. I told you mercury, right? Chronic mercurial poisoning is also called as hydrargyrism. Chronic mercurial poisoning is also called as hydrargyrism. I told you that. Okay. What is the chemical symbol of mercury? You know that is Hg. What do you mean by Hg? Hg, you can remember H for hatters, and G for glass blowers. Right? H for hatters and G for glass blowers. You know very well. They are common in these two occupations. Very easy to remember. H and G, HG. Okay? Hatters and glass blowers. Easy to remember, right? Like, let's move on. The forms of mercury. Let's talk about the forms. When we talk about the form, the first and foremost important form is elemental form. Do remember, friends, the elemental form, it is not absorbed in the GIT. Generally, it is not toxic at all. It is not toxic. You know very well, we are using mercury in the thermometer. You break the thermometer, drink the mercury. You don't have to do anything because mercury is not absorbed in the GIT. It is not toxic. It's not absorbed in the GIT. Okay, but when you take the thermometer, bite the thermometer and have everything inside, not only the mercury that goes inside, even the broken glass pieces also goes inside. That may cause damage. Okay, fine. Going forward, the next important form is organic form. Organic form, do remember, friends, anything that is organic, it is lipid soluble. It can easily cross a blood-brain barrier. It can cause CNS toxicity. It is lipid soluble. In general, organic forms will be more toxic than inorganic form. Now, the example of organic form is, you can see methyl mercury. You also have ethyl mercury, right? For you, for examination purpose, you just remember methyl mercury. That is more than sufficient. The other group is inorganic mercury. Inorganic mercury will be in the form of salt. But under that, you have two groups are there. Number one, we have mercuric. Second one is mercurous. Usually what happens, the mercuric salt will be more dangerous than mercurous salt. Mercuric salt will be more toxic than mercurous salt. Fine. Okay, now you talk about the toxicity in order. The most toxic will be organic form. Right? Followed by mercuric salt, followed by mercurous salt. Let me give you examples of mercuric salt. Do remember, friends, the example of mercuric salt is, you can think of mercuric chlorides. Right? Mercuric chlorides. Mercuric sulfide, which is red in color. I'll show you that. Mercuric sulfide. We also have mercuric thiocyanate. Mercurous salt. Mercurous salt, you can think of mercurous chloride, which is commonly called as calomel. Calomel. That's a common name of mercurous chloride. Early days, they used for children for laxative purposes. Okay, mercurous chloride. There is a difference. You can see anything which is mercuric salt, this is mercurous salt. There is a difference. Don't get confused. Okay, if you want to see that mercuric chloride, I can show you mercurous chloride. This is your mercuric chloride. And this is your mercuric sulfide. People use it as sindoor, vermilion. See, lead tetroxide is also commonly used. This is also commonly used. Both are used in sindoor. Okay, which is toxic basically, which is toxic. Okay, now we'll discuss about the toxic symptoms produced by these forms. Right, for you to remember it better, I've just arranged it in the form of salt itself. We'll be discussing the condition in the form, these forms itself. Let us say when a person is exposed to elemental form, I told you it is not toxic, but there is one important condition. If the person is exposed to vapor, it is toxic. Vapors are toxic. Right, vapors are very much toxic. If any person is exposed to vapor, mercurial vapor for a long time, what happens is, anybody is exposed to mercurial vapor for a long time, what happens is the vapors will get deposition in the anterior lens capsule. Do remember, that is one important MCQ. Which part of the lens that it's getting deposited? Do remember, it is anterior lens capsule. Anterior lens capsule. Okay, this condition is called as mercurial lentis. This condition is called as mercurial lentis. What is the site of deposition, friends? It is anterior lens capsule. Anterior lens capsule. Okay. But do remember, when you examine them with a slit lamp, you can see that the patient is having what is called as malt brown reflex. Malt brown reflex. But usually this is an incidental finding because the patient will not be having any visual disturbance. They will be having normal vision. When they come for something, the routine screening, you'll be able to see the deposition of the mercury. This is called mercurial lentis. Now coming to organic mercury. Organic mercury, there is one important condition that you have to know, which is called Minamata disease. What is that Minamata disease? Minamata disease was a disease which was noted in Minamata Bay near Japan. I can show you. This is your Minamata region, Minamata Bay. What happened was there was a factory which was called the Chisso Corporation, which was discharging all the wastewater into the sea. That was containing effluents of mercury. The entire sea water was contaminated with mercury. What happened was it was taken by small algae, what was eaten by smaller fish, which was eaten by little larger fish, which was eaten by much larger fish. When human beings, they consume this fish, when they consume this fish, it can cause mercurial toxicity. That's what it is called as Minamata disease. Where I told you earlier, Minamata disease is due to organic mercury, methyl mercury. Is it not? It is due to organic mercury. I also told you that organic mercury will be lipid soluble. It can easily cross the blood-brain barrier. These patients will present with CNS disturbances. The patient can present with ataxia. The patient can present with tremors. The patient can present with convulsions. Okay. So do remember Minamata disease. Minamata disease is due to the consumption of fish. There is one more condition that is seen with your methyl mercury, that is nothing but Hunter-Russell syndrome, right? Hunter-Russell syndrome, which is also seen here, Hunter-Russell syndrome, right? So do remember two important conditions. Now coming to inorganic mercury, that I told you, mercuric salt. Mercuric salt will produce what is called as erethism, mercurial erethism. Right? I'll discuss that in detail. For now, you remember it is called erethism. Erethism. Patient will have neuropsychiatric manifestation. Right? The next important one is mercurous chloride. I told you it is calomel. Here, if it is given for children, I told you calomel was commonly used for children. When it is given for children, the child may develop hypersensitivity reaction, wherein the patient will develop what is called as pink disease. Right? It is called as pink disease. It's called as pink disease. Right? I have told you all the manifestations that you have to remember with regard to mercury. Now I'll be discussing in detail about the individual condition. To start with, the first one is erethism. Right? Mercurial erethism. Mercurial erethism, do remember, I told you it is basically a neuropsychiatric manifestation. Wherein the patient will have tremors, neuropsychiatric disturbances. The patient will have tremors, right? The patient will not only have tremors, the patient will also have emotional instability. I told you neuropsychiatric, right? The patient will have tremors, the patient will also have emotional instability. What kind of tremors the patient will be having? See, initially the patient will be having fine tremors, then it will become coarse tremors. You can see the patient will be presenting with fine, then it become coarse tremors, coarse intentional tremors. But typically this coarse intentional tremors, it starts with the hands. Then it progresses into the tongue. Then it is progressing into the limbs of the person, and finally it involves the whole body. When the tremor starts in the fingers, when the tremor starts in the hands, the patient will be having a typical symptom of worsening of the handwriting. Okay, that will be the earliest symptom the patient used to come with. But when the tremors involves the whole body, initially the person will start with tremors in the fingers, worsening of the handwriting, then he will have slurring of speech, ataxia. When it involves the whole body, the patient will be completely bedridden. We call this as concussio mercurialis. Right? We call this as concussio mercurialis. The patient will be completely bedridden. He will not be able to do anything. I was talking about emotional instability. What is that emotional instability? The patient will basically be timid, shy, depressed, alone. He will not be talking to anybody. Suddenly he will be having emotional outburst. He will become aggressive, he will become violent. Right? All these kind of emotional instability is seen with the person who is suffering from this condition. So that it's very commonly seen with people who are working in hat industries. I told you earlier, right? So that is why this particular condition is called as Mad Hatter syndrome. It is also called as Mad Hatter syndrome because a person who's working in hat industries is more prone for mercurial poisoning, and he will always behave like this, Mad Hatter. Okay. The tremors which you see in these people, these tremors are called as Hatter shakes. You know the reason why. It is called Hatter shakes, it is called glass blower shakes, it is called Danbury tremors. So you have lot of synonyms for this. Basically it is a tremor. Basically it is a tremor that you have to remember. Okay, right? Now the next important condition, that is called, I told you, it is due to mercurous chloride. We call this as pink disease. Right? Why this is called pink disease? You need to remember why this is called pink disease, because here the patient will be presenting with painful peripheries, very painful peripheries. Fingers and toes will be completely painful. There will be peeling of skin. The skin peeling will be there. It will be completely pruritic. Right? Itching will be there. It will be puffy, edematous. So all peas, P. It's called pink disease. But there are few synonyms that you have to know. Remember the synonyms. Pink disease is also called as calomel disease, because I told you it is due to calomel. Right? It is also called as acrodynia. You split the word acrodynia. Acro means periphery, dynia means pain. I told you this is painful peripheries. Simple to remember. Right? It is also called as swift fear disease. It is also called as swift fear disease. It is also called as Selters disease. Right? Selters disease. You have so many synonyms for this. Okay, so all this is basically acrodynia, calomel disease, wherein the patient will be having all these features. Typically seen with children. I told you this is basic in hypersensitive reaction. This is basically hypersensitive reaction. Okay, right. Suppose if the patient has come to you and you look at the patient, right? What is the patient is suffering from all these features? You suspect the patient is suffering from chronic mercury poisoning. You diagnose it, and how would you treat it? Right? How would you treat it? What you have to do is, number one, you need to give chelating agent. As always, because it is chronic poisoning, you need to remove the exposure. After removing the exposure, you need to give chelating agents. Right? Chelating agents. What is the chelating agents that you would give here? Number one, you can give BAL. British anti-levisate can be given here, and you can also add DMSA. Right? But if it is Minamata disease, do remember, Minamata disease, you don't have to give any specific chelating agent, because there is, you just have to remove the exposure, that is fine. There is no specific antidote needed for this. There is no specific antidote needed for this, because it is organic mercury. Organic mercury, you just remove the exposure and treat symptomatically. So I've told you all these features which you can see with mercury poisoning. Now I'll tell you how to remember this. Right? What you can remember is, you can remember the mnemonic Hg is metal. Hg is metal. You just know very well that mercury is metal. So we will use that as a mnemonic. H for Hattus. G for glass blowers. H for Hattus, G for glass blowers. I, right? It causes inflammation of the gum. Gingivitis is very common. Inflammation of the gum. Right? Yes, it causes salivation. Increased salivation is noted in this. M, Minamata disease. Minamata. You know that? E for erythism. I told you mercurial erythism. Right? T for tremor. Hatter shakes and glassblower shakes. You know that? A for acrodynia. And the last letter L for lentis. That is nothing but mercurial lentis. You just remember this mnemonic is Hg is metal. You can easily remember all the symptoms associated with that. Okay, Hattus, glass blowers, inflammation of gum, you can see salivation, Minamata disease, erythism, tremors, acrodynia, and lentis. Right? So with this mnemonic, you can remember all the features associated with chronic mercurial poisoning. Right? I'll show you erythism. Erythism, basically, I told you the person will be having emotional instability. The patient will be having emotional instability. You can see the patient will be timid. Suddenly the patient will have emotional outbursts. So the patient will also be having tremors in erythism. Fine. Right. Now we'll move on to another important metal. This is the most common heavy metal that you encounter in your poisoning case. That is nothing but lead. What you are looking at is lead, which is common everywhere. You can see this lead everywhere, right? It is present in all the places. Fine. It is present in the paint, it is present in the petrol, it is present in the bullet, it is present in the pipes. Everywhere you can see lead, right? It is universal. So let's talk about lead. See, lead, the chemical name of lead, the chemical name of lead is plumbum. The chemical name of lead is plumbum, right? So chronic lead poisoning is called as plumbism. Chronic lead poisoning is called as plumbism, which is also called as saturnism. Saturnism, right? Plumbism is also called as saturnism. I told you earlier, this is the most common chronic heavy metal poison. Chronic heavy metal poison. We have discussed about it earlier. Fine. Acute heavy metal poison is arsenic. This is the most common chronic heavy metal poison. This is present everywhere, I told you. What are the different forms that you can see? If you talk about lead, you can see that this is organic form and this is inorganic form. This is organic and this is inorganic, right? Organic form. Organic form, what you need to remember is we have tetraethyl lead, right? Tetraethyl lead. Just now I showed you that it was used in petrol, right? Tetraethyl lead was earlier used as an anti-knocking agent in the petrol, the fuel. Fine. So this is organic form. Fine. I hope you remember I told you it is lipid soluble. So tetraethyl lead, when it is in the air, when it is causing air pollution, it can cause blood-brain barrier. It can cause encephalopathy. We'll be discussing on that. This tetraethyl lead, it is the most toxic lead. Most toxic form is tetraethyl lead. Now coming to the salt, inorganic form. When we talk about inorganic form, we have all the salts. The first important salt is lead acetate. Lead acetate, right? Sugar of lead. This is the most common salt that you come across. Then we have lead tetroxide. This is lead tetroxide. Okay. Then we have lead sulfides. Lead sulfide, and we have one more, that is your lead carbonates, right? I've told you all these names, but I want you to see it and you need to find out where it is commonly used. Lead acetate, lead tetroxide, lead sulfide and lead carbonates, right? I'll show you that. Have a look at it. You can see this is lead acetate, the most common lead, inorganic lead. This is lead acetate. Then you can see, I told you, this is lead tetroxide. Lead tetroxide, you can see people use this as sindoor. I also told you mercuric sulfate was also used for the same purpose. This is again important one. If they ask you which is the most toxic inorganic lead, this is the most toxic inorganic lead. If they ask you which is the most toxic form of lead, then you need to say tetraethyl lead. This is the most toxic salt of lead. This is lead sulfide, which is black in color. People use this for eye lining and all. Okay. And this is your lead carbonate, which is commonly used in paints. So people who are involved in paint manufacturing companies, children who are scraping the wall, eating the wall scrapings, or licking the toys where they use lead carbonate, they have the risk of developing lead poisoning. They have the risk of developing lead poisoning. See, lead poisoning is commonly seen with a lot of occupations like that. You can see this is very commonly seen among painters. I told you painters using lead, right? You can see it is very, very commonly seen in the paints, which is posing not only risk to the people who work in the industries, it is also posing risk to the children who eat it without knowing it. Accidental poisoning is also very common. Okay. When we talk about poisoning, you can see in children, the most common route for poisoning is oral, where they lick the toys with lead paint or they eat the wall scrapings, lead paint. Most common route is oral. When you talk about adult, It is mostly occupational, where inhalational route is most common. Inhalational is most common. Here it is accidental heating. It is accidental heating. Here it is occupational. Occupational. Right? So lead poisoning is very commonly seen with plumbers, painters, printers, polishers, pottery makers. Right? In all these places lead is used, and in all these people work will have the risk of developing lead poisoning. Let us start looking at the signs and symptoms of chronic lead poisoning. I told you already that it is called plumbism. It is also called as saturnism. So we will be discussing on the signs and symptoms of saturnism, also called as plumbism. Right? So it has got a long list of manifestation. We will discuss alphabet wise. Let us start with A. Let's start with A. Okay, when we start with A, remember A for anemia. A for anemia. What is that anemia? It causes normocytic normochromic anemia due to suppression of bone marrow. It also causes microcytic hypochromic anemia. It also causes microcytic hypochromic anemia. The reason being it has got effect in the hemoglobin synthesis. It affects the hemoglobin synthesis, where it inhibits ALA dehydratase. It inhibits ALA dehydratase. It also inhibits ferrochelatase. Remember this enzyme. These are very important enzymes. Even it was asked in last year exam. It was one of your PYQ. Okay. It affects, lead basically inhibits multiple enzymes in the heme synthesis. Predominantly it affects two important enzymes. Number one, ALA dehydratase. Another one is ferrochelatase. Don't get confused that it is not ALA synthase. It is ALA dehydratase. Okay. Fine. So the patient will be presenting with microcytic hypochromic anemia. Let us talk with B. Right? The first B is Burtonian line. What is that B? The first B is Burtonian line. Burtonian line. What is this Burtonian line? Do remember, friends, this Burtonian line, it is seen among, you can see this is the teeth and you have got gums. Right? You have got gums. What happens is, when a patient is exposed to lead, what happens is, it gets converted into lead sulfide, and wherever you have dental caries, this lead sulfide will get deposited as blue line. Right? You can see it's a blue color deposited in the gingivo-dental junction. You can see in the junction of the gums and the teeth. You can see this is a blue deposit, which is nothing but lead sulfide. I told you the key word. This is seen with teeth with caries. Right? And it is commonly seen with the maxillary teeth, upper teeth. It's commonly seen with upper teeth. And you need 1 week of exposure for this. Basically, this is subepithelial deposition. Right? Subepithelial deposition. This is basically nothing but your lead sulfide. Keep that in mind. It is lead sulfide. Okay? Because wherever you have caries, dental caries, you have the multiplication of bacteria which produces hydrogen sulfide. The hydrogen sulfide combines with the lead, which is resulting in lead sulfide formation, and that gets deposited. Okay? That gets deposited. Burtonian line. And you also get similar kinds of blue color lines. Not only in lead, you also get that in mercury poisoning, you also get that in iron poisoning, you also get that in copper. Copper, we get Clapton's line, which is more of greenish in color. It is not only seen with lead, that's the point. But the term, this Burtonian line, it is typically used with regard to lead. Burtonian line. Burton's line. It's also called as Burton's line. Okay, doesn't matter. The next B that you have to remember is basophilic stippling. Right? When I say basophilic stippling, don't think that it is seen with basophil, guys. It is seen with RBC. Right? RBC. When you have an RBC, inside the RBC, you can see the blue colored dot. They are basically basophilic stippling of RBC. That is because of, these basophilic stippling are basically inclusion bodies. Whenever you have inclusion body, that is suggesting that you have some problem with erythropoiesis. This is dyserythropoiesis. Fine. So if you want to know the mechanism in detail, I'll tell you the mechanism in detail. What happens is, whenever there is reticulocyte which is maturing into complete RBC, This is normal erythropoiesis. You will have some ribosomal fragments in the reticulocytes. When the reticulocyte is maturing into mature RBC, what happens is these ribosomal fragments will be removed. These material will be removed from the cell by the enzyme 5-pyrimidine nucleotidase. 5-pyrimidine nucleotidase. But lead, what it does is, it is inhibiting the 5-pyrimidine nucleotidase. When this enzyme is inhibited by lead, what happens is, this particular material will be staying in the RBC itself, which we call it as basoflex stippling. Right? This is the mechanism. This is the concept that you need to understand. Okay, I told you 1B, that is Bertonian line. I told you 2B, that is basoflex stippling. The third B is your bone line. Right? What is that bone line? You can see there is radiodense opacity in the metaphyseal region of the long bones. Metaphysis of long bones, particularly in children. Long bones in children. Right? It is not radiolucent, it is a radiodense. You can see the dense opacity in the metaphyseal region. I'll be showing you that. You can also call this as lead line. Right? Lead line. Do remember, this Bertonian line is due to the deposition of lead sulfide. I hope you remember that. But lead line is not due to the deposition of lead. It is due to the deposition of calcium. It is due to the deposition of calcium. Okay? There is an abnormal mineralization process because of which the calcium gets deposited excessively. That's called lead line. Okay. So moving further, let us talk about C. We have what is called as colics. We also have what is called as constipation. We have constipation. What is that colic? It is also called as painter's colic. It is called as painter's colic. You know the reason why? Right? It is also called as saturnine colic. Saturnine colic, right? Because it is, plumbism is also called as saturnism. It's called painter's colic. It's called saturnine colic. The patient will have severe nocturnal pain, cramps, nocturnal, very severe pain will be there. And the patient will also have constipation. That's why this is called dry belly ache. Dry belly ache. There's one more C that we have to remember, that is nothing but Cabot's ring. Right? Inside the RBC, you can see a figure of 8 filament that is called Cabot's ring. Right? So, A, B, C. The next letter is D, where you have drop. Lead affects the motor nerves. Lead affects the motor nerves. When the motor nerves are affected, the patient will be having wrist drop and foot drop. Wrist drop and foot drop. Fine? D foot drop. Then we have encephalopathy. I told you earlier, encephalopathy, the organic lead will easily cross a blood-brain barrier. It can cause lead encephalopathy. This is commonly due to what is called as tetraethyl lead. TEL means tetraethyl lead. I told you this tetraethyl lead is basically causing CNS manifestation. Do remember, this tetraethyl lead is more toxic to developing brain. Developing brain. That means usually the children will be affected. The child will be having learning disability. The child will be irritable. The child will be irritable, learning disability, memory disorders. All these features will be there. With regard to the child, remember it is irreversible damage. Irreversible damage. Irreversible damage. Tetraethyl lead. We stopped using tetraethyl lead in the fuel. We don't use it now. Okay. The letter F for facial pallor. The letter F for facial pallor. And do remember, friends, this facial pallor is the most consistent sign. Most consistent sign in lead poisoning. Perioral, circumoral pallor. Right? Perioral pallor. Fine. It is due to vasospasm. Perioral pallor. And G for gout. Right? What is the other name of plumbism, friends? Saturnism, right? So that's why this gout is also called as saturnine gout, which was again asked in one of your INI-CT exam. Okay. So we also have HIJK, LMNOP. We are not going to that. We stop with G. Okay. Fine. So A, B, C, D, E, F, G. You can easily remember by these alphabets. So we'll just see whatever we have seen so far. Right? You can see this is the hemoglobin synthesis, where I told you two important enzymes are inhibited. Number one, ALA dehydratase. Not synthase, dehydratase. Number two, ferrochelatase. Fine. Remember, dehydratase and ferrochelatase, when these enzymes are inhibited by the lead, what is getting elevated in the blood and urine? Remember, ALA will get elevated in the blood and urine, and protoporphyrin will also get elevated in the urine. So, by these two things, you can use it for diagnosis of lead poisoning. These two things will be useful for diagnosis of lead poisoning. Okay, going forward, you can see this is Basophilic stippling. Right? You can see Burtonian line. I told you this is seen with upper teeth, caries teeth, and this is your Cabot's ring. Right? The patient will be having severe abdominal colic. I told you colics. Right? This is constipation. Patient will be having dry belly ache. This is lead line. Fine. What are the lab tests that you can use for diagnosis of lead poisoning? You can see the blood picture anemia, right? What are the other findings that you can see? In the blood, I told you, you can see increased lead level. You can see increased free erythrocyte porphyrin. You can also see ALA. Increased ALA will also be noted in this. Okay? Urine, the same thing. When you take X-ray of a long bone, you can see the presence of lead line. Right? If the patient has come with poisoning with lead and you take X-ray abdomen, you can see the deposits, right? Radio-opaque deposits of lead in the GIT also. X-ray abdomen, right? All these things will help you to find out the lead poisoning. And if they ask you which is more reliable, I told you blood lead level will be more reliable. I told you earlier, we discussed about that. Coming to the X-ray fluorescence. X-ray fluorescence will tell you the whole body lead burden, right? The X-ray fluorescence. Blood picture. I told you that we need to look at the blood picture, right? These findings alone, blood picture findings also is very important, right? It affects the blood picture in multiple ways. It induces polycythemia initially. It causes microcytic hypochromic anemia. We know the reason why. It causes anisocytosis. It also causes poikilocytosis, and it causes Cabot's ring. We discussed about that, and you see this is Cabot's ring. Okay, right? Moving forward, you can see basophilic stippling. We know what is the reason. It is the inhibition of 5-pyrimidine nucleotidase which is causing this basophilic stippling. Okay, we discussed all these things. Now, what about the treatment aspect? How would you treat? Obviously, you need to remove the exposure. We know that. Right? What is the most important antidote that we can use? We use calcium disodium EDTA. We use calcium disodium EDTA. That is the best antidote that we have got for lead. But do remember, friends, if it is severe lead poisoning, you cannot use EDTA alone, because EDTA cannot cross blood-brain barrier. If you are not using any other agent in severe lead poisoning, it will cause redistribution of lead to the brain. Patient will have worsening of the symptoms. So what you have to do is, if it is severe lead poisoning or if it is lead encephalopathy, what we have to do is, either you have to combine BAL with EDTA, or we have to combine DMSA with EDTA. Particularly what they say is, if the patient has got lead 60 to 80, right, then you can assume that it is severe lead poisoning, and you can use this combination. Okay, BAL is injectable form and DMSA is basically oral form. Depending on the condition of the patient, you can either prefer BAL or you can prefer DMSA. Okay, the point is you cannot use EDTA alone. That's the point that you have to understand. Okay, right. So this is what you need to understand. Right. The next important metal that we have to know is about cadmium. What is that cadmium? Okay. What does it do? See, cadmium, you know, this cadmium, it has got one important property. What is that property? It replaces cadmium, it replaces calcium from the bone. It replaces calcium from the bone. I'll tell you the concept. You don't have to memorize it. Just do understand the concept that it replaces calcium from the bone. The bone will become weak. Right? When the bones become weak, bone will be softening. You can see bone softening. We call this as osteomalacia. Right? When there is severe bone softening, the patient will have bony deformities. The patient will have bony deformities. Because of this deformities, because of this softening, the patient will have multiple pathological bony fractures, not traumatic fractures. Pathological fractures will be there. The patient will have intense, severe bone pain will be there. Bone pain will be there. Severe bone pain. Severe bone pain. We call this condition as Itai disease. We call this condition as Itai disease, which is also called as Ouch disease. Right? Patient will be complaining of pain. It is called Itai disease or Ouch disease. That is nothing but cadmium. Where you need to understand the mechanism. Mechanism is replacement of the calcium from the bone, where the patient will be having all these features. Patient will have severe bone pain. Remember pain, remember ouch disease. Okay, ouch disease. The next metal that we have to learn is about thallium. I told you that it is poisoner's poison. If you're a poisoner, right, your poison would be thallium. Okay. Generally, it was used for homicidal purposes. I told you majority of the properties are satisfying with that. Thallium acetate is there. Thallium sulfate is also there. Thallium sulfate is also there. Thallium acetate is also there. This thallium acetate is basically colorless, tasteless, odorless. Colorless, tasteless, odorless. Thallium acetate. Okay. Right. You see this thallium. You don't have to remember anything. Just do remember ban. Right? What is that ban? Do remember ban. The first one is it causes butterfly rash in the face. Right? Butterfly shaped rash in the face. Okay? Dermatitis. Second one is A for alopecia. A for alopecia, particularly the patient will have alopecia with madarosis as well. Madarosis. Right? Lateral aspect of the eyebrow lost. Madarosis. Fine. And you can also see Ullrich-Mees line. I told you when we were discussing about arsenic poisoning, it is not seen only with arsenic poisoning, it is also seen with your thallium, Ullrich-Mees line. And N for neuropathy. What is that neuropathy? It is peripheral sensory motor polyneuropathy, and that is the reason, right? It is also resembling GBS. Right? It is also resembling GBS. Alright? Fine. You can see BAN, butterfly rash, alopecia, Ullrich-Mees line, peripheral sensory motor polyneuropathy. It not only causes butterfly rash, there is one more important feature that you have to remember. The patient will also be exhibiting behavioral change. Right? The patient will also be exhibiting behavioral change. Do remember this band. You will remember thallium poisoning. Thallium. Okay? Fine. So iron poisoning, so this is another important poisoning which is very commonly seen in accidental manner. Accidental, particularly from the overdose. Children, very commonly affected. Children accidentally take the supplementary iron tablets. When they accidentally take this iron tablets, overdose may cause iron poisoning. See, when you take iron tablets, supplementary tablets, it's available in the form of ferrous sulfate, ferrous fumarate, and ferrous gluconate. These are all the different preparations available. As I told you, normally it is taken by the children accidentally, and the overdose can cause iron poisoning. See, when you look at the signs and symptoms, the clinical features, do remember there are basically 4 stages are there. Stage 1, wherein the patient will have gastroenteritic phase. Gastroenteritic, where the patient will have vomiting, abdominal pain, and all these gastroenteritic features can be noted. Gastroenteritic phase. Stage 1. Right? Stage 2, wherein basically the patient will be having improvement of the symptoms. Asymptomatic. There may be mild acidosis that can be noted in this, but the patient will be having little improvement in the symptoms which may mislead the treating physician. This gastroenteritic can be seen up to 6 hours. Right? 6 to 24 hours, the patient may be having little kind of improvement, which we have to be in which stage, which we'll have to be very, very careful in not getting misguided. The third phase is basically the patient will have multi-organ failure, and basically the patient will be having liver cell failure. multi-organ involvement will be noted. Multi-organ involvement, particularly hepatorenal failure can be noted. Liver cell failure can be noted. Patient will be presenting with jaundice, patient will be presenting with all other liver toxicity symptoms can be noted. This can be seen somewhere between 1 to 2 days, right? 24 to 48 hours. The last stage is stage 4, wherein the patient, chronic stage, wherein it is due to basically the fibrosis, the stricture and the stenosis, right? It is basically bowel obstruction. The patient basically present with bowel obstruction features due to stenosis, strictures can be noted in this. It's the last phase, right? But this will take around more than 2 weeks. 2 weeks to 6 weeks, wherein you can note this. 2 weeks to 6 weeks. Okay, so basically we have got 4 stages. Gastroenteritic, asymptomatic, multi-organ involvement, that is liver cell failure, and the last one is bowel obstruction, stenosis along with stricture. When the patient comes to us, the most important treatment is decontamination. The decontamination is the most important treatment that you need to give, and the next important thing is you have to give chelation. What chelating agent that we can do for iron poisoning? Do remember, we have desferrioxamine. We can give desferrioxamine, and in severe cases we can also go for hemodialysis. That can be done in severe poisoning cases, right? So the most important and chelating agent that we have got is desferrioxamine. You can see iron poisoning, we have seen desferrioxamine, we have already seen that in the topic chelating agents. Okay, so do remember the stages. Yes, friends, we'll be discussing on the next important irritant, that is non-metallic irritant. So far we were discussing about metallic irritants. Now we'll be discussing about non-metallic irritant. Okay, I have given you examples of non-metallic irritant when I was discussing about the classification. I told you about phosphorus, chlorine, bromine, iodine, all these things we discussed. But now we are going to discuss about the most important non-metallic irritant, that is nothing but your phosphorus, right? Yes, friends, let us discuss about phosphorus. The meaning of the word phosphorus means bringing light. Phos means light, bringing means, phorus means bringing light. So basically it's bringing light. See, there are 2 important forms of phosphorus. One is white, another one is red. Okay, so we have white phosphorus, we also have red phosphorus. These are the 2 important forms of phosphorus. This white phosphorus, when you are exposing it to air, it becomes yellowish, oxidized. So white phosphorus, yellow phosphorus, both are used synonymously. Okay, don't get confused, both are same. Right. You need to have a look at this white and red. You can have a look at this yellow phosphorus or white phosphorus, and this is your red phosphorus. Have a look at this. This red phosphorus and white phosphorus, it is waxy and it is crystalline. Okay. Red phosphorus is easy to find out. It is reddish and it is powdery, amorphous. Okay. That's an easy way to differentiate. We'll be looking at the toxicity and we'll also be looking at the properties of these phosphorus. But before that, we need to know where we use it and why it is important for us to learn about this. Okay. So let's learn about that. First, we know where it is commonly used. See, it is commonly used in rat killers. We can see it comes as a cake. It comes as a paste. We popularly, we can see that it is commercially available as Rattol paste. Rattol. You can see it is like a Colgate pack. Colgate paste. Right there, no? The pack which is actually red and black. The similar kind of packing will be there in Rattol paste. So many of the times people get confused between Rattol paste and Colgate. Rattol paste and Colgate paste. Okay. And other place where it is commonly used is your crackers. Very, very commonly used. Phosphorus is one important ingredient for all crackers. And that's why during Diwali times and all, this kind of accidental poisoning with crackers among children is very, very common. They also call it as Diwali poison. Okay. Fine. And then you have this agricultural. In agricultural, it is commonly used in pesticides, insecticide and pesticide. You can see this presence of white phosphorus. See, these are the places where we use white phosphorus. And when any person coming with this kind of background, you can always think about the possibility of white phosphorus toxicity. And this is where we use red phosphorus, the tip of the matchstick. Okay, so this is the tip of the matchstick where we use red phosphorus. Earlier we were using white phosphorus also for matchbox purposes, but nowadays we don't do it because of the toxicity of the white phosphorus. We don't use white phosphorus nowadays. We use only red phosphorus, that too in the tip of the matchstick. Okay, now let's talk about the properties of the phosphorus, so that let's also discuss about the toxicity later. I was telling you we have 2 types, right? White and red. Let's talk about Toxicity. Which is toxic? White or red? Which is toxic? Do remember, white phosphorus is toxic, red phosphorus is non-toxic. White phosphorus is toxic, red phosphorus is non-toxic. Okay, and we should also know about the other properties of white phosphorus. Let's have a look at it. Number one, it has got garlic smell. It has got garlic smell, garlic odor. And do remember, it is luminescent. It will glow in the dark. Right? It will glow in the dark. Luminescent property we also call as phosphorescence. Phosphorescence, that is an important property of white phosphorus, not with red phosphorus. And it emits fumes. It emits fumes. White phosphorus emits. You can see the smoke coming out from the white phosphorus. And always you keep the white phosphorus under water. Preferably you need to keep the white phosphorus under water. Otherwise, if you take it out, it will catch fire. It is prone for spontaneous combustion. We call it as pyrophoric property. Right? We call it as pyrophoric property, which is otherwise called as spontaneous combustion. You need to always keep it under water, otherwise it will catch fire. It is prone for spontaneous combustion. It will catch fire. Okay. Coming to the red phosphorus, whatever properties you discussed in white phosphorus, nothing is there for red phosphorus. Nothing is there. Right? It is non-toxic. It is no odor, odorless. There is no luminescent property. There is no emission of fumes, and it does not burn on exposure to air. Okay. So nothing is there for red. Everything is for only white. Now, let's talk about the important toxic action. What is the mechanism of action in case of white phosphorus? What is the basic mechanism of action? You need to remember, it is called as protoplasmic poison. It is called protoplasmic poison. Okay, protoplasmic poison. Basically, it is causing injury to the cell, right? It is causing, particularly, it is causing what is called as necrobiosis of the cell. It is basically toxic to the hepatic and renal cell. Basically, it will cause hepatic toxicity, very, very toxic to the hepatocytes. Right? Very, very toxic to the hepatocytes. Do keep this in mind. So we'll be discussing about this basic toxicity when we are discussing about the poisoning as well. Okay. So do remember that it is very toxic to the hepatocytes. Very toxic to the hepatocytes. Now let's talk about the exposure. Let's talk about the exposure of this white phosphorus. When you talk about the exposure, either it can be a poisoning, oral ingestion, or it can be occupational, or it can be contact. Suppose, see this white phosphorus on contact with the skin. This white phosphorus on contact with the skin, it causes very severe pain. On contact with the skin, what it causes? It will cause contact with the skin. It produces second and third degree deep burns. Second and third degree burns will be there. It will be intensely painful. Burning sensation will be intensely painful when it is exposed to skin. Whenever it is exposed to skin, it can cause second or third degree burns. Okay. And what you can do is, like, you can just apply copper sulfate, right? Or you can apply silver nitrate as a topical paste for this kind of removal of phosphorus from the skin. Okay. So that is what you can do. You can apply topical application of copper sulfate or silver nitrate. Olden days it was being used. Now, let us talk about oral ingestion. Oral ingestion, we have two important types of poisoning. One is acute poisoning. Another one is chronic poisoning. Acute poisoning is there. Chronic poisoning is also there. First, we'll discuss about acute poisoning. Then we'll be moving on to chronic poisoning. Okay, first let's talk about acute poisoning. Acute poisoning is very commonly seen among children. It's very commonly seen among children. Right? As I told you, people accidentally, they consume fireworks, the crackers. Right? Without knowing that, accidentally they consume this kind of crackers. I told you, Diwali poison, to remember that. So this particular poisoning with children is very common among the cracker consumption. Not only that, do remember, it is also seen among exposure with adults. Basically, it is rat killer suicidal ingestion. Rat killer suicidal consumption. So we can get acute poisoning. Acute poisoning. Fine. So what are the signs and symptoms that you get? Basically, when a person is poisoned with arsenic, I mean white phosphorus, we get three important stages. Okay, we'll be discussing on that. Stage 1, we can see. So this is white phosphorus. I told you it is luminescent property. You can see that it is got phosphorescence or luminescent, which is always with white phosphorus, not with red phosphorus. Okay, right. So this is the burns that is produced by your phosphorus exposure. You can see I told you 3 stages are there with oral consumption. Number 1, this is a stage of gastroenteritis. Patient will be having features of gastroenteritis. You will have intense burning pain throughout the GIT. The person will have vomiting. The person will have loose stools. Very, very common with this stage 1, right? The person who has got vomiting and loose stools, when you look at the vomiters and loose stools, do remember it has got garlic odor. It has got garlic odor. That garlic odor is given by the presence of phosphorus. Not only that, you need to see the stools and the vomiters, particularly in the dark, because it will be luminescent. It will glow in the dark. This is one important property. Many times it was asked in your exams as MCQ point. In which poisoning that you get luminous vomiters and stools, it is nothing but your white phosphorus toxicity. Okay, it has got luminescent property. You get luminescent stools and the vomiters in case of white phosphorus. And not only that, you can see this kind of vomiters and loose stools, right, emitting fumes. It emits fumes. You can see fumes coming out from the stools and the vomiters. Okay, stools and the vomiters. And this type of feature is called as smoky stool syndrome. Remember, this is called smoky stool syndrome. You can see the stools, lot of smoke coming out from the stools. Okay, smoky stool syndrome. This is stage 1. Okay, stage 2, the person goes into asymptomatic stage, but this stage is so very important, right? This is around 1 day the patient will be moving on to asymptomatic stage. This is very, very important because the patient might be showing some signs of improvement. Patient will not be having any kind of symptom, but we should not discharge the patient. We should, suppose if the patient has been discharged and the patient moves on to further toxicity, the doctor can be liable for the medical negligence. So you need to remember, do not discharge the patient in this stage, right? Do not discharge the patient in this stage. This is stage 2, which is very transient. It can extend up to 1 to 4 days. Then the patient moves on to stage 3, where the patient will be having multi-organ failure. Particularly, the patient will be having features of liver toxicity and renal toxicity. Very, very important, where the patient will be having signs of liver cell failure. Maybe the patient has got jaundice, the patient will have pruritus, the patient will have asterixis, coagulopathy will be there, and the patient will also be having flapping tremor, hepatic encephalopathy. All features of liver cell failure can be noted with this particular stage 3. This stage is highly important and serious, right? The patient may die because of multi-organ failure. When you talk about the fatal dose of phosphorus, it's very, very less. Even 1 milligram per kg body weight can be fatal. 1 milligram per kg body weight, that itself can be fatal. 1 milligram per kg body weight, right? How do you treat this patient? Treating this patient, first, when a patient has come to you with this kind of acute exposure, you can do decontamination, we can do gastric lavage. But do remember here, what we can use is, we can use potassium permanganate. 1 in 5,000 potassium permanganate can be used. But do remember, don't use any oil or emulsions, because the oil will increase absorption. Any oily solution or something, it will increase absorption. The patient may end up with worsening of the toxicity. You should not do that, right? And also, when the patient is moving on to liver cell failure, we need to give liver support measures. Either you can give vitamin K, N-acetylcysteine, sometime even the patient moves on to further very severe toxicity, finally we need to do liver transplant. There is no other measure that can help the patient out. Okay, right. So these are the treatment aspects we have got for acute phosphorus poisoning. Now you can see medico-legal importance. I've already told you what are the medico-legal importance. Suicidal poisoning, it's very, very rare. It's very rare. It's not preferred. You know why? Because it is very painful. It's very painful, right? I told you when we were discussing about ideal suicidal poison, the most important property, a patient will choose the poison for committing suicide. It should cause painless death. This will cause painful, so it's not usually preferred. And accidental, I told you, in case of children, patient might have a consumption of accidental crackers accidentally, or even adults, you can have this rat killer consumption can also be there. Fine. And homicidal. See, it's not commonly used. You know why? It's not commonly used. You know why? Because of the smell because of the smell and the taste of the phosphorus. You can easily find out. You cannot mix it with something, give it to the victim. Victim will easily find out, so there is something different with the taste and the smell. But sometimes what do they do is they mix with coffee and alcohol, then they give it to the victim. When you add coffee or alcohol, it will mask the taste and the smell. The patient might consume it without knowing it. Okay, there is some advantage of giving this phosphorus for homicidal purpose. You know what? Number one, the onset will be delayed. Right, the multi-organ failure stage, it will be delayed. Okay, there will be a delay between, there will be a gap between the consumption and the severe symptoms. Number two, even if the patient develops the symptoms of liver cell failure, it will mimic natural disease. Patient might not think about the poisoning case, it will mimic natural disease. And the third important thing is the phosphorus which is gone into the body, it will be oxidized in the body itself. After death, when you do autopsy, even if you send it for analysis, it's very difficult to find out because most of the phosphorus would have been oxidized in the body itself, in the body tissues itself. So there are some advantages of giving phosphorus. I told you what are the advantages. So all this is about acute phosphorus poisoning. But do remember, when we talk about phosphorus, the chronic phosphorus poisoning is very important for examination purposes. We'll discuss about that. Why it's so important? Chronic phosphorus poisoning. See, you need to know where they commonly use. Chronic phosphorus poisoning. Chronic phosphorus poisoning. First of all, you need to know where it is commonly used. Okay, it's an occupational exposure. It's an occupational exposure. In olden days, right, it was used in the matchstick. I was telling you, right, the white phosphorus was used in the matchstick. There is something called Lucifer matchstick. Lucifer. You might have seen in many movies that strike anywhere matchstick. You can take a matchstick, you can take a matchstick, you can strike anywhere, it will start burning, right? You can burn it, right? You can strike anywhere, it will start burning. Fine, so that's called Lucifer match. Earlier it was called as Lucifer match, strike anywhere matchstick. But the problem is, in that matchstick, they will be having white phosphorus in the tip of the matchstick. So the problem is, people working in that kind of matchbox industries, without the knowledge, accidentally, they used to inhale the vapors of phosphorus. Inhalation of vapors. When they inhale the vapors for a long time, what happens is they'll start developing osteomyelitis of mandible. They will develop osteomyelitis of mandible, and this osteomyelitis of mandible, the jaw symptoms, this is particularly called as, do remember friends, this is called phossy jaw. You can easily remember that it is due to phosphorus, it's called phossy jaw. Not only that, it is also called as Lucifer jaw, because I told you that it is because of the Lucifer matchstick where they were using it. Nowadays, we don't use this. Okay, it's called phossy jaw, it is called Lucifer jaw, it is also called as glass jaw. Do remember the synonyms, many times you get questions on that. Even in this year, you got a question on this white phosphorus toxicity in your INICET examination, right? So you should know about this chronic phosphorus poisoning. Right, what are the symptoms the patient can have? I told you that it causes osteomyelitis of mandible, so you know what are the symptoms produced by any osteomyelitis. Initially, the patient will be having intense pain. The patient initially will be having intense pain. Patient will be presenting with toothache. Tooth pain will be there. After some time, what happens? There can be swelling in the mandible, in the jaw. Then what happens? There can be lot of sinuses discharging pus. You can see pus discharging. You can see pus discharge from the multiple sinuses. And do remember, this pus will be smelling garlic. Right? Garlic smelling pus will be there. And when you look at the mandible, it will be having osteomyelitis. And sometimes what happens, these osteomyelitis can even worsen into what is called as osteonecrosis of mandible. Right? This is one important MCQ point. They can ask you that in which poisoning that you get osteonecrosis of mandible, it is nothing but your white phosphorus toxicity. So do remember, it has got osteomyelitis, osteonecrosis. Fine. So do remember about this Lucifer matchstick. Fine. Lucifer matchstick. But nowadays, this is safety matchbox, right? Nowadays, we don't use this kind of white phosphorus in the tip of the matchstick. We are using oxidizing substance in the tip of the matchstick. Fine. That is strike anywhere matchstick. And I told you about this phossy jaw. Have a look at the phossy jaw. This is important. And you can see this is the Lucifer matchstick. Okay. You can strike it anywhere. It start burning. Okay, you must have seen many of the movies where our stars used to have this, fine? And this is the Fosse jaw, right? This is called Fosse jaw, Lucifer jaw, wherein you can see the extensive myelitis of the mandible. And people who are working in this kind of environment, the one thing that you have to do is do dental screening periodically so that you can avoid this kind of consequences. Okay, dental screening is important. Now, you must have seen this picture. Right, so phosphorus, white phosphorus, in olden days it was commonly used for creating arson. Let's suppose if you want to burn somebody's hut, there is a hut and you want to burn it without getting caught, they were using this white phosphorus, right? What they used to do is they used to take a cow dung which is fresh and moist. Okay, you take a ball of cow dung, keep white phosphorus inside the cow dung, okay, and you throw on the roof of the hut. You go in the night time and throw it on the roof. In the night time, the temperature is not warm, so white phosphorus is covered by the moist cow dung. It will not burn. When the morning, what happens in the morning when the sun rises in the morning? Temperature becomes a little hotter. So what happens is the moist cow dung becomes warm and become hot. When it is hotter, the white phosphorus which is present inside the cow dung will start burning. Right? For the owner of the hut, for the other people, it will look as if suddenly the roof is burning without any reason. They might be thinking it is an act of the god or something, but actually it is not the act of the god, it is act of you who has who have thrown the white phosphorus on the roof. Okay, so in olden days it was used for burning the hut, arson. Okay, so just do remember this is another special point about white phosphorus. So all this is about white phosphorus. I was talking about acute poisoning. I was also talking about chronic poisoning. Thank you.